thanking McAllister President Brian Roseberg again for the warm introduction and for hosting this community event, and all the McAllister staff who helped us put this together. McAllister College is a Minnesota treasure. It produces both thinkers and active citizens, and I'm very, very pleased to be here tonight. I would also like to thank retired Army Specialist Herb for leading us in the Pledge of Allegiance and for your service to our country in Iraq. Thank you. To all the 4th District residents who are here, inside, as well as those of you who are outside, thank you so much for joining us, and I'm glad the weather is what it is this evening. For those of you who don't live in the 4th District, I want to thank you also for attending tonight's meeting. Today we're going to focus on what every American family, every American business is a stakeholder in, and that is health care. Over the past few weeks, we've all seen the video of congressional hearings that have turned into unproductive shouting matches, and that's not the way tonight's meeting will be conducted. I welcome passionate opinions on this issue, and I expect you to share yours with me. I have strong opinions about health care, which I will share. I welcome your comments, your ideas, your concerns on health care reforms and goals supported by President Obama, whether you support them, oppose them, or are uncertain about them. Tonight, my goal is to listen, and I have every expectation that tonight will be insightful and respectful, and it will be an opportunity for constituents to voice their views. This is my 9th year in Congress, and I'm sure those of you who have attended past town hall meetings will see tonight's behavior no different than in any of my other town hall meetings. In other words, it will be conducted with respect and willingness to listen to all voices and all opinions with respect. Next week, I'll be returning back to Washington as Congress goes back into session. As we all know, health care legislation will be the #1 priority of the House of Representatives. My position on health care should not be a mystery to anyone here. I believe that health care should be a right for all Americans. Earlier this year, I introduced legislation to amend the U.S. Constitution, House Resolution 4, the Health Protection Amendment that would make health care a right for all citizens of the United States. I believe strongly in this goal. Universal health care coverage can make our great nation not only healthier and stronger, but more productive. Critics of making health care a right often say, well, we already have universal health care. People can go to the emergency room and access it if they really need it. That is the best example of why I believe our health care system in America is broken and it needs to be fixed. Our healthcare system is broken when we live in the wealthiest, most powerful country in the world. But healthcare is a privilege available to only those with enough money to afford insurance, or for those of us who are fortunate enough to have jobs that provide us with health insurance. 60 million Americans have no health insurance or are underinsured. These tough economic times and the loss of a job or an employer's benefits go through belt-tightening often means the loss of health care for millions of our families. Our health care system is broken. When our country spends $2.4 trillion a year for health care, almost twice as much per person as any other country, but we rank 37th in the world for health care outcomes. Our health care system is broken when care is rationed because someone is between you and your doctor making health care choices, and that is an insurance bureaucrat. And for example, you may have heard of the term rescission. This is when an insurance company finds a pre-existing condition or a technicality to cancel coverage for a sick policyholder. rather than paying the claim. This is also called dumping the sick, and it needs to stop, and it needs to stop now. System is broken when there's 150,000 unnecessary deaths each year from avoidable medical errors and substandard care. Measuring poor outcomes is not an empty statistic. It's measuring needless lives lost, lives which could be saved if we fix healthcare. Our broken healthcare system and the people who live in our community deserve better. And I'm going to share with you from two constituents, neighbors of ours. This letter is from Brad, and I received it 2 weeks ago in the St. Paul office. I need your help. Over a year ago, I was laid off from my job as a project manager at a local nonprofit organization. I couldn't afford the COBRA payments to continue my coverage from my employer, so I applied for private insurance. I was denied due to pre-existing conditions. I've been sick for 2 weeks. I'm not sure what's wrong with me because I cannot afford to see a doctor. I've tried calling the community health clinics that offer sliding fee services. The ones I spoke with are no longer taking new patients, or they have waiting lists for over a year. I know that if I need emergency care, I can go to the local hospital, but I'll still get a bill, and I can't afford to pay it. I don't think my current situation is life-threatening, but the anxiety caused by my uncertainty is mounting. What will happen to me if it is something more serious? And here's another letter from one of our neighbors, Ken. Ken lives in St. Paul. Fortunately, I get health insurance coverage through my employer. This past year, instead of layoffs, my employer has chosen to freeze salaries, but the cost of healthcare premiums and co-pays are not frozen. Some of the treatment options are not covered, or they're further reduced in coverage. In any case, we have insufficient income to cover new tests and procedures. We are still paying for my wife's breast cancer surgery for 5 years ago, and we now owe more net worth on our credit card companies. I have put off my recommended screening for colon cancer because of the cost of testing. And if the test is positive and any procedures are recommended, we will not be able to consider them anyways. In the meantime, I'm looking for part-time work to supplement our household income so that my wife will have some options for her medical care. I am competing with thousands of newly laid off workers in the Twin Cities. These are just 2 brief accounts. Our office receives letters daily from real people. The effect that they are going through, that our neighbors are going through, our family members are going through because of what is broken in our healthcare system. As the healthcare system debate continues, Minnesotans like Brad and Kevin, and all of us have a lot at stake. I want you to know tonight that healthcare reform is not a guarantee to be passed this year. There's a real possibility this entire debate could end this year. Why? That's because the opponents of reform are fighting to maintain the status quo. Fighting for the status quo is not about protecting people's health. It is about protecting billions in corporate profits. My Republican colleagues I want to hear from people, and it's very nice to have the applause back and forth.